Yeah, dear Dr. Neureiter, welcome here to ESCRS, and thank you very much for introducing the ESCRS Micron M7 and Lexacore femtosecond laser. I would like to ask you a few questions. Why are we using lasers in ophthalmology?
I think ophthalmology without any laser usage, you can't imagine it anymore. Laser has been used for more than 50 years in medicine, and actually it was the first time in ophthalmology for retinal tears. And since then it's a very important surgical instrument for us. Company ESCRS is having an excimer laser which is doing an ablative procedure and remodeling the surface of the cornea by reshaping and changing the optical properties. And apart from the excimer laser, they've got a new femtolaser, the Lexacore laser, which is like a very sharp surgical knife which can cut in every transparent medium like the cornea or even in the lens of the eye.
What do you think are the advantages of ESCRS technology?
In my experience, you have much more working space, so you can really see the patient's head in front of you. You don't have a machine covering the patient's head, and so you have much more working space during the surgery, which is very convenient.
There's a small applicator on the excimer laser which moves down. Can you explain a little bit what that's doing?
Well, this applicator, it's like a joystick. It's very easy to use by just turning it, and then the microscope is going up and down, and so there's no need of a motorized patient's bed anymore. So you do the focusing, you do it with this microscope, which is easily moved up and down.
Do you think there's a clinical advantage in using a special eyepiece on the excimer laser with a smoke plume removal and using a repetition rate of 600 Hertz, which is quite high?
Yes, for sure. You've got a very high precision concerning your surgical ablation, what you do by the excimer laser. You have a very small spot and it's more predictable in comparison to other lasers.
What do you think about the docking procedure and the autocentration feature of the Lexacore femtosecond laser?
Like the ESCRS laser, the Lexacore laser uses the robotic arm to dock on the patient's eye, and you have the touch screen to control the eye, and you see on the touch screen very easily you see the position, so you can really make sure that it's docked properly.
You can use the ESCRS lasers together with other laser equipments of other manufacturers?
Yes, of course, there's no problem. As I told you before, the device is quite small, especially the Lexacore femtolaser, so you can easily combine it with lasers from other companies.
Oh, super, that's really great to hear. Thank you very much, Dr. Neureiter, for giving us a quick insight into our new technology, and thanks very much for coming.
Yeah, thank you very much for having me.